Hello friends, myself Dr. Love Krishna Pal Singh Rathod, MS Shalyatantra Assistant Professor. Care of AIDS, HIV and hepatitis infected patient. This is our today's topic. Introduction about HIV. Little bit introduction we are discussing about this. AIDS, acquired immunodeficiency syndrome, is a fatal condition caused by a retrovirus called as human immunodeficiency virus. It breaks the body's immune system. First case of AIDS reported at Thailand in 1984 and now it spreads rapidly throughout the world. Many a times HIV infected persons remain asymptomatic but they are capable of transmitting disease. Incubation period is 5 to 7 years. The HIV has been found in blood, semen and CSF in more concentration while saliva, breast milk, urine and vaginal secretion in low concentration. What is the mode of transmission? Sexually transmission is the commonest mode of transmission. Vaginal, oral and anal sex. Blood contact is also the commonest mode. Intravenous, drug abuse, blood donors, blood recipient, healthcare personnel, breastfeeding, maternal to fetal through placenta. Clinical manifestation of HIV infection: diarrhea longer than a month, fatigue, significant loss of weight, malaise, fever more than 1 month, night sweating, generalized lymphadenopathy, Kaposi sarcoma, red-brown nodules on skin, mucosa, severe recurrent infections like warts, dermatophytosis and folliculitis. HIV and mental health. Good mental health is essential to living healthy with HIV. Reach out, get the care and support you need. Laboratory diagnosis: ELISA, Western blot, absolute CD4 count, lymphocyte count which is less than 2000 per cm. Hepatitis B. Now we are discussing about hepatitis B. It is a viral infection that attacks the liver that can cause both acute and chronic disease. The virus is transmitted through contact with the blood or other body fluids of an infected person. Hepatitis B is an important occupational hazard for health workers. It is also spread by percutaneous or mucosal exposure to infected blood and various body fluids as well as through saliva, menstrual and vaginal fluids. The increasing prevalence of HIV and hepatitis B increases the risk to the healthcare worker due to exposure to blood from patients infected with HIV and hepatitis B virus, especially when blood and body fluid precautions are not followed for all patients. Healthcare workers. Healthcare workers are defined as persons including students and trainees whose activities involve contact with patients or with blood or other body fluids from patients in a healthcare setting. Standard precaution to be taken. It combines the major features of universal precautions, body substance isolation and are based on principles that all blood, body fluid secretion except sweat, non-intact skin and mucous membrane may contain transmissible infectious agent. Standard precautions include a group of infection prevention practice that apply to all patients regardless of suspected or confirmed infection status. These are the list of standard precautions. Always follow this standard precaution. Perform hand hygiene, use personal protective equipment, use and dispose of sharps safely, perform routine environment cleaning and clean and reprocess shared patient equipment, follow respiratory hygiene and cough equipment, use aseptic technique, handle and dispose of waste and use the linen safely. It includes this all which I told you earlier: hand hygiene, use of gloves, mask, eye protection, face shield, safe injection practice and use of socks. This is also the picture which is showing the droplet precautions for all staff, for visitors, for all airborne precautions. Before entering room, perform hand hygiene, N95 mask, check the mask, and then after leaving room dispose the mask and also perform hand hygiene. Keep door closed at all time. For all staff, contact precautions are this: before entering room the same hand hygiene, gown, gloves, and after leaving the room disposal of gloves, gown and apron, and then again hand hygiene. Some preventive measures. When examining a patient for per-rectal examination, per-vaginal, gloves should be worn by medical staff. When possible, use maximum disposable instrument. Reusable instruments should properly autoclaved or sterilized. Medical staff, those having injury, are not allowed any surgical or VAD procedure. Avoid needle, scalpel or any other sharp injury. Medical staff and students who enter in OT wear disposable gowns, cap, mask and slipper. If any medical staff or medical student who exposed to HIV infected patient, blood should be taken. Antiretroviral therapy like zidovudine, didanosine, lamivudine, indinavir and nalfinavir. Hand hygiene. Avoid unnecessary touching. Wash hands frequently. Use hand rub also. Perform hygiene before and after contact. Do not wear artificial fingernails. Don't use nail paint. Don't wear any ring. Don't wear any bangles. This is the picture which is showing how to wash your hands. This is also the picture showing how to wash your hand. These are mainly 6 steps are there. Okay, this is the complete picture showing how to wash hands before and after leaving the room. How to wear gloves. Wear gloves with proper fitting and durable, disposable. Don't repeat same gloves, discard it properly. This is the picture showing how to don gloves. Okay, this all takes 20 seconds. How to remove glove is also important. This is the picture showing removal of gloves pattern. Proper wearing of gloves. No rips, no tears, no issues. Safe injection practice. Take care to prevent injuries when using needles, scalpels and other sharp instrument or devices, when handling sharp instrument after procedure, when cleansing of used instrument and when disposing of used needle. Use an aseptic technique. Single use items. Don't reuse. Do not recap, bend, break or hand manipulate used needles. Making smart injection choices prevent needle stick injuries. This is very important. One needle, one series, only one time. This involves safe injection practice. Prevent hepatitis, blood and injection safety. The injection is the most important thing to take care of that. Steps for giving injection. Preparation to give injection, then filling of syringe, site selection, preparation of skin, giving injection and proper disposal of waste. Precaution for invasive procedure. An invasive procedure is defined as surgical entry into tissue, cavity, organ or repair of major traumatic injury in an operative room, delivery, emergency department, OPD and dentist clinic. Cardiac catheterization, angiographic procedure, vaginal delivery, caesarean delivery, other invasive obstetric procedure involving bleeding, manipulation, cutting or removal of any oral or perioral tissue. Precaution to be taken. Use appropriate barrier precaution, protective eyewear, gowns, mask, wear apron in OPD also. If glove is torn, remove the gloves. If a needle prick occurs, then immediately change the needle and take safety procedure. The risk of infection following a needle prick injury with needle from an infected source patient is 0.3% for HIV, 3% for hepatitis C and 6 to 30% for hepatitis B. Take care of that. Hepatitis B immunization. Routine immunization of health worker against infection with HBV is an effective way to protect them. This vaccine is effective, cost effective and widely available. Immunized early in their career. Use a 0, 1 and 6 month schedule of 3 injections. Do not administer booster routinely because protection is lifelong. This is the picture show how to wear gloves. Mask. Reasonably snug against skin all around. Swampy interior climate. Nose covered to the bridge. Mask tucked under chin. This importance also shown in COVID era. No rips, no tears. This picture is again used. Face shield, which is very useful in to protect it from COVID also. This is the gown and a complete HIV kit, cap, mask, shoes, everything is present. This is the picture of HIV AIDS kit, which includes face mask, gown, cap, bed sheet, disposable gloves, shoe cover, goggle and waist carry bag is also present. These all are the material which are present in HIV kit. These are also the material which are present in HIV kit. Covering of operative area with plastic material and whole sterile sheet. This is the picture showing how to wear a gown and how to remove a gown. This both of things are very important before and after surgery. This is the picture during HIV patient OT. Thanks a lot.